This is Core Conversations with Natalie Baggio.
Welcome to Core Conversations. I'm Natalie Baggio, and today I'm joined with Chris Fox, our Chief Nurse Executive at Corewell Health Lakeland Hospitals. Welcome, Chris. Thank you for being here today.
Yes, thank you for having me, Natalie. I'm excited to be here.
So how long have you been a nurse?
I have been in nursing for 40 years. I started my career back in Pittsburgh, where I was a new graduate in critical care. Quickly learned that I loved leadership, and the passion has never died for me. Just love being a nurse.
I'm sure you've seen a few things change over 45 years.
Just a few.
You know, as nurses, as me being a nurse as well, we talk a lot about clinical excellence and the importance of how we practice as nurses and how that really drives patient outcomes and patient experience. But as a chief nurse, how would you describe clinical excellence?
Sure. You know, we always think about having excellent outcomes, but I think it starts with having a whole team that shows up every day. They're here to devote their time and their energies to doing the very best they can for our patients. They're compassionate, they're thinking, they're engaged, and that always helps to lead toward excellence for our teams. It's also, you know, I have found that there's a need to always foster a culture of open communication. We have to have every team member feel, and especially our nurses who are at the bedside with those patients day after day, that they can advocate for their patients, that they can speak up, they can use their voices, that we listen to them, and we take their thoughts and ideas to always improve the care that we have. And then I think another important piece of excellence is the team that we work with. It's supporting each other. We have to come when we show up every day to be there not only for our patients, but for each other, to foster an environment of learning, accountability, and empathy and caring for our team members. And that helps us put the whole package together for excellent care.
I love that you mentioned advocacy and culture, but it goes beyond that as well. It's like investing in nursing's growth and how they continue to evolve, because that clinical excellence changes over time and that definition of it. I know when I moved here, I was so impressed with the amount of support our organization gives to our nurses and the investment for our nurses to continue to grow in their education. And
Absolutely.
I know we've transitioned a lot of nurses from associate's degrees to bachelor's degrees. And I'm sure you're really proud of that work too, which all drives the clinical excellence.
Yes, absolutely. It's been so nice to see our nurses who have just thought about going back for their bachelor's degree to achieve it and to be excited about it and to bring that knowledge that they've learned through that education back to the bedside to help take care of their patients.
So despite all the great things that are happening, what are some of the things that might be keeping you up at night?
Oh, boy. Certainly a few of them. So excitement as well as concern. So the exciting part is nursing is just, I still have a passion. I always will have a passion for being a nurse. And there will be continued opportunities and growth and new expansions into the nursing field that is very exciting. What's concerning is workforce shortage. We know that that is a real challenge out there. Burnout of staff and of nurses, and to try to keep them at the bedside, loving what they do. We try to focus on making sure they have the support, the tools, the equipment that they need so that they can give their best every day. We're also really looking at our care models and designing models that are something that our team members want to be, to grow into, and to stay for a sustained period of time with us. So challenges, but a lot of great opportunities as well.
I'm excited about the innovations that are coming to make work more efficient. But also, I remember when I became a nurse, mainly nurses practiced in a standard way. But today, nurses can infiltrate different positions throughout healthcare, which I
Yes.
think is very exciting, but also creates challenges for the workforce shortage.
Yes. And we know there's so much work going on into preventative health. So that when we thought of nursing, it was typically at the bedside in a hospital, but that's changing, as you said. There are new careers opening for nurses, and I think that'll continue to expand. Nurses will be out in the communities helping to prevent illness and keep patients well instead of the traditional focus on achieving wellness after somebody has been ill.
So a lot of great things in the future.
Absolutely.
So what is something you're most proud of?
I love mentoring new leaders. And we have the opportunity as leaders and as nurse leaders to do that every day. Whether it's how we role model, how we lead a meeting, how we take time to talk to people. This year, we did just start a new program. It's called the GROW program. And I think you've had some of our GROW interns with you. It is guiding nurses into healthcare workplace futures. So it gives them a chance to get out there and see what leadership is. Just as we have staffing shortages at the bedside, we still have to maintain leaders, strong leaders in our future. And this GROW program takes a nurse away from their traditional job for a whole month. And they rotate through various departments in the hospital, in the Corewell system, to really give them some experience. So I'm proud of that. I love to see new leaders succeed, new nurses who've come from the bedside or frontline step into leadership for that first time. It's exciting to see them make that change.
Well, I've had an opportunity to meet a couple of your GROW interns, and over the program, I've just seen their confidence continue to grow, which they feel ready to take that next step in their career. And that's very exciting. And since you have this passion for mentoring future nursing leaders specifically, what advice do you have for other leaders?
Always to stay curious. We always have to be asking ourselves curious questions. How do I do it different? How do I make it more efficient? How do I help my team succeed every day? And I think one of the biggest things that I always have to remind myself is to stop and listen. Very actively listen to what's being said to you. And that helps you gain so much as a leader. To take the time, pause, reflect on what's being said, and stay curious with moving forward.
I love that. Staying curious, embracing our values will help us embrace change. Well, it's been such a pleasure having you here today. Thank you very much for joining me on this episode.
Thanks, Natalie. Appreciate being here.
Thank you for joining me today on Core Conversations. Please join me in our next episode to continue this conversation with our leaders who are making an impact every day in our community.